Okay. Good afternoon, everyone, and a warm welcome to each one of you. We thank you and acknowledge you for taking out the time in your busy schedule and assure you that for your time. Before we start the webinar, I would like to set our intention behind taking this session. You must have heard this story before of a man walking along the beach, and he notices a boy who is hurriedly picking up things and gently throwing them into the sea. As this man approaches the boy, he sees that this boy is picking up starfish and throwing them back into the ocean. So the man asks this boy, "Young man, what are you doing?" The boy replies, "I am throwing back the starfish into the sea. If I don't do that, they'll die because the tide is going back." So the man laughs and says, "There are miles and miles of beach and thousands of starfish. You cannot make any difference." So this boy answers. He picks up a fish and throws it back into the water, looks at this man and gently answers, "I made a difference to that one." So today our intention is to be able to make a difference to as many lives as possible and to help to reduce the impact of this pandemic. It gives me great pride to introduce our speaker for the webinar, Dr. Tariq Jagmag. He is my dear friend and I have known him from the past 18 years. He is now also my teacher and mentor, and he is a teacher and mentor to many people, many doctors and specialists across the globe, who also lovingly call him Guru. So he is indeed a true specialist in psychoneuroendocrine immunology and scientific-based homeopathy. He has publications in indexed, peer-reviewed scientific international journals. He has also been a guest speaker at national and international conferences, including the Federation of Clinical Immunology Society, that is FOCIS. He has 2 patents. One of them is of Immucil, an effective combination of herbs that treats a number of diseases including COVID and long COVID. I have sent across the papers of the same to you for going through them previously. He is a genuine, humble person who strives to improve the health of human beings by focusing on right diagnosis and getting to the root cause of the disease. I usually refer to him as the CID of the human body. So without any further delay, let us welcome Dr. Tariq to initiate this webinar. Thank you, everyone.
Thanks for that wonderful introduction, Dr. Shamal.
Thank you.
So let's start with this series. My goal is to actually just talk about fatigue in COVID and long COVID. But of course, if you have any other questions about COVID, you can still ask me that. But I'm trying to restrict this talk to just fatigue because fatigue itself takes a long time to explain. So when a person has COVID, one of the first symptoms that they start having is fever and chronic fatigue. Even after COVID is over and the RT-PCR comes negative, many patients suffer from this fatigue. And it continues for many months altogether. The estimation worldwide is that around 40% of patients with COVID end up having long COVID where they have chronic fatigue. Of course, besides the chronic fatigue, they have many other issues. For example, they have palpitations, they can have high blood pressure, they end up diabetes. But all of these things are somehow linked to fatigue, and that's what my research is about. So the pill that we have developed, Immucil, targets some aspects of this fatigue, but there are also others that it doesn't target, and that's what I'd like to explain. There are a few things that you can do by yourself. For example, you can buy a few homeopathics online or from a local homeopathic shop that may also help you. So I'm going to try to explain all of these things. If you have any questions during my teaching, you can just type them on the chat box and I will instantly answer them. Okay? I'm going to try explaining these things on share screen so that it becomes easier when I draw them down. So let's start with the share screen. Okay, and what is so special about me that I can talk about this? See, the first paper that we published was on the innate immune system's response to COVID, and we published this paper in a international journal where I basically spoke about how the innate immune system is more important in dealing with COVID than the adaptive. So in the beginning, when you have an infection, it's your innate immune responses that help to remove the infection off. Usually, if it's a viral infection, you usually recover within 3 to 4 days. But in COVID, after the 7th day or the 6th or 7th day, patients start getting severe. The reason why they get severe is because the innate immune system has not been able to remove the infection. Now it gives the job to the adaptive immune system, which takes a week to respond. And when the adaptive immune system is not able to respond because the virus has basically knocked it out, at that time the innate immune system overinflames and you have damage due to the COVID or the COVID virus. So we were explaining about how our low-dose cytokines help with COVID. The next paper that we published, it got accepted just last week. I mean, it came back from publication last week. And in that paper, we spoke about the role of oxidative stress, which is being produced by that innate immune system, which is malfunctioning, and how that is causing damage. So the entire theory of it is basically oxidative stress. You guys must have heard of what oxidative stress is. It's when your body starts creating a burn, it starts increasing oxidation in order to burn infections out. But this burn, if it's not controlled, can cause you damage to your body, which is why in order to decrease the burn, one of the treatments used in COVID is steroids, which have to decrease the burn. But steroids cause a lot of other problems in your body. For example, they increase your blood sugar, they cause your blood pressure to go up. So there is a need to have a therapy which does all this, decreases inflammation, and actually does good for your body rather than harm. So let's start with just talking about what is happening in fatigue in COVID, and I'm going to try to do it by doing a share screen and drawing on screen. So let's talk about fatigue here. Now, what have we done with Immucil which makes it work on this fatigue is what I'm going to talk about. So the fatigue of COVID firstly is caused by an oxidative stress enzyme called as NOX2. This NOX2 is known as NADPH oxidase. It's an enzyme which is present in your neutrophils, which are a part of your innate immune system. This NADPH oxidase increases to allow the neutrophils to make free radicals. And these free radicals help to target infections in order to remove them. But oxidative stress is not useful for a viral infection. It's very good if you have a bacterial infection, but if you have a viral infection, it's very, very bad. When NOX2 is elevated, not only will it cause you fatigue, but it also causes your blood vessels to vasoconstrict. So what we have noticed, and what many of you doctors and patients as well would have noticed, is that your blood pressure starts to increase after you get COVID. You get sudden tachycardias, your heart rate starts to increase all of a sudden. You have palpitations with increased blood pressure. And that is mainly caused by this enzyme, which is NOX2. There was a study done in AIIMS in India where they found patients who have COVID, who have recovered from COVID, and they checked the arterial stiffness of these patients, where you can measure using pulse wave velocity, which is a type of test. You can measure the stiffness of the blood vessels. Whether the patient had high blood pressure or he didn't have high BP, all these patients post-COVID started having elevations in their arterial stiffness. And even using antihypertensive drugs or supplements like vitamin C and magnesium made no impact. Again, the reason why this was happening is because of elevations in NOX2. So our pill Immucil brings the levels of NOX2 down. By decreasing it, it decreases your risk after COVID of getting a heart attack, decreases the risk of getting so many issues. And the symptom that you will have may not even be elevations in blood pressure. All you may find is that you're fatigued. You're mentally fatigued, you're physically fatigued, you have poor exercise tolerance. So remember, in this, there is poor exercise tolerance. How does Immucil do that? We have extracted a certain component of a herb called as kutki, and with that component we have shown in our published paper of how it decreases NOx2. In fact, it decreases NOx2 to such an extent that it becomes one of the most powerful antioxidants which are known. It has a better ability than even glutathione, which is the gold standard in antioxidants, to decrease that NOx2. And we have found that when we are giving it to our patients, we've done around 30,000 plus patients worldwide. When we give this to our patients, their blood pressure starts to decrease, their abdominal fat starts to decrease, and I'll explain why that happens. And even patients who are diabetic after getting COVID, they start reversing their diabetes. Again, that is simply because of NOx2. We are currently working to develop a test for oxidative stress, which will be out quite soon in the market. The test is basically a urine test where the patient has to pass urine in a cup, and we check the level of a compound known as 8-isoprostane. If your 8-isoprostane levels are high, that means you have a large amount of oxidative stress in your body, which could be causing you anything from insulin resistance, diabetes, to even high blood pressure. The second thing that Immucil does, and this was tested by the International Center of Genetic Engineering in India, what it does is it starts killing off the COVID virus. Again, in about 20 to 25% of patients who have had COVID, we find that the COVID virus or the COVID virus's DNA is present in the cerebrospinal fluid months and months and months after you have recovered from COVID. This is the viral DNA which is causing you a lot of damage. This is called as viral persistence. So having an antiviral agent to work on this is what is required. Immucil kills about 71% of all the SARS-CoV within just 2 days of the patient taking it. So because of its antiviral effects, it's decreasing the fatigue caused by COVID as well. And as I said, it can be used not just when you're having COVID, but even after you've recovered from COVID. The third aspect is that it decreases the cytokine storm in COVID. So it decreases the levels of IL-1, TNF-alpha, and IL-6. If you've seen, this is the reason why patients are given corticosteroids during COVID. We want to decrease this. So how we tested it is we tested it versus a very strong anti-inflammatory agent called as indomethacin. Indomethacin is the most strongest anti-inflammatory agent there is. So we induced edema or a paw edema in a rat. We checked the levels of IL-1, TNF, and IL-6. Once those levels went up, we started giving the rat indomethacin. And the control rats were given, or the other set of rats were given Immucil. Immucil had a very, very strong effect. Even it was almost double the effect of the dose of indomethacin. So it will strongly inhibit IL-1, TNF, alpha, and IL-6, which is why Immucil also works very, very well for arthritis. When you have osteoarthritis or rheumatoid arthritis, adding Immucil helps quite a bit. So this is the anti-inflammatory effect of it. What does IL-1, IL-6, and TNF-alpha do in the body? When interleukin-1 is there, say there is a blood vessel inside your body, say this is in your heart. When interleukin-1 is expressed on the blood vessel wall, it causes all your white blood cells to leave the blood vessel and attack the tissue of your heart, creating myocarditis and inflammation in the heart. When TNF-alpha increases, it will do the same thing. Again, it will cause the neutrophils to increase and enter inside your cardiac tissue and other organs of your body. When IL-6 increases, it increases a factor called as ferritin. And at the same time, it starts decreasing your iron levels. As your iron levels drop, you start becoming prone to hypothyroidism. You start having chronic fatigue again in your body. You start having restless legs in your, which affect your body, and you start becoming prone to multiple infections in your body. Bringing IL-6 down and ferritin down has to be done very gently, because if you say you use a drug like tocilizumab and it blocks interleukin-6 very strongly, by doing this, you make yourself prone to other infections. Interleukin-6 is required for antibody formation. So when you bring it down, you need to bring it down gently. And you also need to bring this ferritin down, and you need to increase your iron levels. All of these things are possible with Immucil. So the first most important reason of having fatigue in COVID and post-COVID is, remember, the oxidative stress, which is why Immucil works so well and decreases that oxidative stress. It's also going to decrease your blood sugar levels because again, it is interleukin-1 which causes damage to your pancreas and starts causing beta cell damage to your pancreas. Again, oxidative stress plays a role in diabetes as well and increases your blood sugar. So this was just about Immucil. Let's look at the other causes of fatigue. There's a question, so let me answer that. Okay. Oh yes, we have a person, our doctor friend, whose name is Dr. Rupali, who was suffering from long COVID, and I guess we could ask her to share her experience of how we treated it before we progress to the remaining causes of fatigue. So would you be able to talk about your case, Dr. Rupali? Let me see if Rupali is there.
Hi, I'm there.
Yeah, hi.
Hi.
Hi, we can hear you.
Yeah. Okay. I suffered COVID in May. Okay. After that, around 6 months, I was like low in energy, and my hypertension started by that time. I used to have 140, 180, like 110, 180. So, ekdam high level of hypertension. And with medicines, sometimes it used to come down. Then again, I used to have with medicines also. I used to have palpitations. The worst thing was like working in my clinic for a prolonged period was like very fatigue causing. It was like I was very low on energy. I couldn't do exercise. I had put on a good amount of weight, and I had put on a good amount of weight, and it was actually taking toll on my health overall. But few medicines which Dr. Tariq told me had really helped me with it. Actually, with that, I have started exercising. In fact, last 2 days I am doing 108 Surya Namaskar in a go, and with no hypertensive drug at a like I have not had a hypertensive drug since last 8-10 days. At like in between, if I feel I have it, but otherwise also homeopathic medicines also I am very less on it. But initially 1 month I took it properly. After this, all my medicines have reduced, almost no medicines, and this was I was like I would have been with it was like hypertension could have actually reduced my energy and everything else, but now I am okay with it. Like I don't care more about it, and I really don't have good energy to swim, to do Surya Namaskar, to do all my exercise, at least 1.5 hour exercise, which was not possible before starting these medicines.
So you can tell us what your current blood pressure is? Is it stable now?
Yeah, absolutely fine. It's like
okay.
Absolutely fine.
And you'd like to say how what were the medicines that I gave you and how fast they affected you?
You had given me Natma, Ignatia, then Sepia. Sepia has actually worked for my palpitations, good for my palpitations. And Ignatia has worked well for my hypertension. And medicines were like hardly of any cost. But yeah, my confidence had come back in 1 week itself. I had started working out after a week.
And I think I gave you Immucil as well, right?
Because Immucil is something. Yeah. Immucil is something which has given me good energy. And one more thing with the coconut oil thing.
Yeah, the Phospholiv, which helps.
Phospholiv, that is also amazing because I have seen changes in my skin texture also after that, and I have started losing weight. My weight was very stubborn. It never used to move. That has actually started improving, and my I told Shamal also, I spoke about it. I have started losing inches. That was I have not observed it before this, but with Immucil and with all these homeopathic medicines, I'm really happy with it. Immucil I'm still having regularly.
Yeah, Your mom's also having it for her diabetes, right?
Yeah. And so many of my problem. I like to tell about my son also. Can I?
Yeah, sure. Go ahead.
Yeah. My son was allergic to like
Cold water.
yeah. Just one second. Just one.
I think she's a busy doctor. Okay.
Hi. There's an emergency actually, so I had to attend. Uchal na baba. Hello, my son had a cold urticaria and it was very bad. It was very bad. Like once we had went out and he was into the river water. Once he was out of that water, like he told me kuch bite kiya, and he came out of that water. And whole of his body, from his nail to his forehead to his ears to everything was scaly. Erythematous, पूरा swollen, आंखें पूरी सूजी हुई थी. His sclera was red. His eyelids were heavy red, erythematous, and it was a very shocking thing for me. And I was like, काय झालं? नाही, मम्मा काहीतरी चावलं. And we don't know what happened. So after that, we were trying to get him from the place. The place was around 2 kilometers away from the main road because we had been to the river waterfall. So we had walked down 2 kilometers. There the thing was, and he was not able to walk also during that period. So he was like, "Mama, mala disat nahi hai. I can't walk also." It was almost like an anaphylactic. I was very scared of that moment. He used to have rashes here and there momentarily, but I didn't bother. But this was a very huge thing to happen, and I don't know where to go, what to do. He had when I spoke to Tariq told me that it is a cold urticaria. Cold urticaria is like when the part which is exposed to the cold gets swollen. And then he asked me some of his history and all, and then he actually narrowed it down. It is cold urticaria only, and we have to treat it. So for this cold urticaria, then I got to know that whenever he used to have ice cream, his lips used to swell. If he has poured some cold water in his body, the area where he used to pour the cold water, his body used to get scaly, red, erythematous. Within 15 days of medications we started, my child's cold urticaria actually vanished. After that, he had entered water in November or Diwali, where we went out. He entered water at 7:30 in the morning, and his body was not scaly. Then after that, that thing has actually vanished. Ice cream khata to his lips doesn't swell or something like that. But it was a very bad thing for me. I was like, we don't know the solution and what to do. But with the simple medicines, he has calmed down also. And his urticaria, I'm not bothered now. Now he can do anything he wants. Yeah.
Thanks for that. But we want to stick to COVID over here. So
yeah,
I'm going to have to cut you short. Let's get back to the COVID. Yeah. But thanks a lot for sharing your case.
Welcome.
Thanks. So let's get back to the whiteboard. Okay. So this is the last thing that we spoke about, which is the NOx2, the viral persistence which happens, and the chronic inflammation that is happening in the body. Now we have other causes of fatigue. So let's look at them. One of the causes of fatigue that we've seen is the patient has cortisol imbalances in their body. So cortisol is a natural hormone which is made by our body whose job is to decrease inflammation. And cortisol is triggered off by a hormone called as ACTH. This is coming from your pituitary. When we started checking patients with long COVID, we found many of them have poor levels of ACTH. So ACTH is low. And when we check their cortisol levels, we also find that the cortisol levels are low. Now, ACTH is a hormone that triggers cortisol. So if the cortisol is low, your ACTH should ideally be high. But we are finding patients who have low ACTH. That means the pituitary has forgotten how to respond to the adrenal gland, since cortisol is made by your adrenal gland. So what we started doing for these patients, and I'll explain the symptoms of these patients. When ACTH is low, your appetite tanks. You start having very low appetite. You also start having very low thirst. So your thirst starts to tank. And you become very, very weepy by nature. You become very cranky by nature. You become tired and you become weepy by nature. You can all of a sudden just start crying. When your cortisol levels drop, you can't maintain your blood sugar, because when your cortisol is normal, when you wake up in the morning, it's your cortisol surge that happens and gets your blood sugar up so that you can start your day. If your cortisol is low, especially in the morning, you start having sugar cravings. So patients with long COVID and even patients with COVID who are having these problems start showing sugar cravings. Wake up in the morning with a very sweet tooth. They want to eat something sweet, otherwise they're not able to maintain their glucose. They start having headaches if they have not eaten their food on time. These are all features of having low cortisol. Now, we can do one of two things. One is that we can simply give my ACTH low dose to patients, which helps to bring the ACTH up and corrects their problem. But if you just want to use a homeopathic for this, if you have a low ACTH and you have these symptoms, you can use a homeopathic called as pulsatilla. And if you have low cortisol, you can use another homeopathic called as Natmor. It was this Natmor which I gave to Dr. Rupali to help bring her cortisol up, which is what helped her for the initial bit where she stopped having sugar cravings, food cravings, and she became emotionally calmer. So the symptom that can happen with low cortisol besides the sugar craving, what you can see in a patient's blood test is you start seeing that the total white blood cell count is low. The TWBC starts to drop. So if your normal TWBC is around 4,500, these patients usually have low white blood cell counts of around 4,300, 4,000, etc. etc. So this is again a very important cause of chronic fatigue and even fatigue in patients with COVID. We should be checking the ACTH and their cortisol levels. And if they are abnormal, we should be treating them. Let's go to the next thing. A lot of patients who have COVID are taking zinc supplementation. Now, while zinc is a really good supplement to take, it has certain deleterious effects on the body. For example, what are the side effects of having zinc which is too high in your body? The first side effect is that you're going to get a fungal infection. And fungal infections cause a lot of fatigue. So we have Dr. Chen with us, who's a geriatric specialist, and she told me this over the phone a few days ago, that when she gets patients who have severe dementia and they come all thrashing and they come all delirious in the hospital with hallucinations, the first thing that she does is she gives them an antifungal tablet. The moment they take the antifungal, they become emotionally calm. They stop thrashing around, they stop having all those hallucinations. In fact, in patients with severe dementia, Parkinson's and Alzheimer's, you'll actually find fungal DNA present in the brain of these patients. So COVID patients who've taken a lot of zinc develop fungal infections, which can even lead to brain fog and dementia. In fact, there's a published paper of zinc in Alzheimer's. It can severely worsen Alzheimer's. So you may start forgetting things and you start having poor memory. Remember, all this is because of zinc. How do we notice that the patient is having a fungal infection? One could be really obvious. They have a fungal patch on the skin, very easy to diagnose. But many of these patients don't have a fungal patch on the skin. They have it on their tongue. So you ask the patient to stick their tongue out, and when they stick the tongue out, you start seeing that there's a lot of white coating on the tongue. The tongue is all coated white. This is a sign of a severe fungal infection or candidiasis. Another very peculiar feature we've seen when zinc levels go very high is the patient starts having crawling under the skin. They feel as if insects are crawling under them. So that's one other feature of crawling sensations. And remember, it is a fungal infection which is causing fatigue. So all we do for this is we tell the patient to go off zinc, and we start the patient on an antifungal, and voila, the patient's fatigue improves. Okay, so that's your third reason for fatigue in patients. What's the next reason for fatigue? Many patients after recovering from COVID have exercise intolerance. Yeah, when they exercise, they start panting. This exercise intolerance, besides cause of NOx2, they have a deficiency of a factor called as clotho. So there's exercise tolerance. In patients who have poor exercise tolerance, what we usually do is we check their vitamin D levels. and we check their kidney function. We find in many patients have poor kidney function. They start having elevations in their creatinine. These patients have taken a lot of vitamin D. In fact, they've taken so much of vitamin D because they've been told that vitamin D is good for COVID, that they have a lot of phosphates which they're absorbing into their body, because vitamin D causes you calcium and phosphate absorption. Now the phosphate has to be eliminated out of your body because it's toxic for your body. So your body compensates by increasing a factor called as FGF23. In order to dump the phosphate out, it increases a factor called as FGF23. This factor usually combines with another factor in your body called as Klotho, and then starts to dump that phosphate out of your kidneys. But you know what? When you have COVID, Klotho is not only required in your kidneys, it's required in your lungs. In your lungs, it's your primary antioxidant. It stops your alveoli from dying. So if you've taken all that vitamin D and you already have COVID, and your FGF23 now doesn't have a friend to work with because Klotho is getting depleted, phosphate starts to build up and FGF23 levels start to go high. As these levels start to go higher and higher without the effect of Klotho, your kidney starts to malfunction and your creat starts to go high, which means that your kidney cannot remove toxins out from your body. This FGF23 also causes vasoconstriction. Your blood vessels start to vasoconstrict. Secondly, it starts reducing your RBC counts. Now, this lower RBC count is what you will see in your patient's blood test. You'll find that the RBC counts are becoming depleted. And the patient starts having fatigue because of it, and they start having poor exercise tolerance. All we have to do in these cases is we tell the patient, hey, look, please stop taking all that vitamin D. And we give them a low dose of ours, which is called as Klotho. So this is available in a liquid. We just give the patients orally to take this. The Klotho levels increase and simultaneously the RBC count starts to go up. We've treated many patients with chronic renal disease as well using the same concept. We just give them Klotho, stop vitamin D, and the patient's creat starts to drop. So this is another reason for poor exercise tolerance in patients with COVID. Let's look at more. One more cause of your patients having fatigue after COVID may be that they are still continuing to take ivermectin. Ivermectin is believed by many to be a golden drug for COVID. While it may or may not work for COVID, we don't really know. Some studies do show that it has some effect on COVID, while other larger trials show that it has no effect in decreasing the mortality in patients. Whatever may be the case, if you continue to take ivermectin every day, ivermectin is a GABA agonist. It increases the levels of GABA, which is a neurohormone which basically helps to calm you down, which is good. However, when GABA levels increase too much, it can start causing you something known as hypoxia, which is low oxygen tension. How does this happen? You see, when you're at rest and you're just taking air into your lungs without really sucking it in, that volume that you're taking it in your lungs at rest is called as the tidal volume. Any drug which is a GABA agonist is going to decrease your tidal volume, which means that instead of taking the 500 ml at rest, you're not going to be able to take that 500 ml. So what you're going to do is you're going to start using your external muscles of respiration. So you're going to start using your thoracic muscles, your clavicular muscles, and you're going to try to suck the air in. So you start feeling breathless very easily. So the symptoms that the patient gives is they start feeling breathless. Again, it's very simple to stop this. You just have to stop ivermectin and your exercise tolerance will improve and your fatigue will go away. So this is one other common problem that we find. Let's look at the others. Now, the last part of it is about the cytokine storm that's happening in COVID. So how do you know there's a problem over there, and what are the blood tests that we do? So we normally just get a CBC done. As I said, in the CBC, we look at the RBC counts. If the patient's RBC count is low, remember there's a problem with Klotho and we just give them low dose Klotho. If your patient is having iron deficiency anemia, okay, that will be seen in the CBC as well, where the patient's hematocrit will be low. But you can also get another test called the Serum iron studies done. So let's say you find a patient with a low iron. Okay, the patient has a low hematocrit. Now you want to know whether it's an absorption defect or it's come from inflammation. In the serum iron studies, you see a marker called as ferritin. If this patient's ferritin is high, that means he has high levels of IL-6 and he still has viral inflammation present in his body. For these patients, we need to use another one of our medications called as lactoferrin. And lactoferrin absorbs iron into it, holds it in, so that this ferritin, which is also doing the same thing, doesn't have to do it. Ferritin levels start to fall, interleukin 6 levels start to fall because lactoferrin is also an inhibitor of IL-6. So along with Immucil, we also give lactoferrin when the ferritin levels are elevated. What if the patient has a normal ferritin? He has normal ferritin yet has a low iron. That means the low iron is not coming because there's inflammation. The low iron is happening because there's poor stomach acid. This is another cause for chronic fatigue. If your stomach acid is low, you can't digest food very well. If you can't digest food very well, your protein levels will drop and you'll start having fatigue. You'll also start having drop in B12 levels and a drop in iron levels. So if this patient is having iron deficiency anemia and a low hematocrit, but he has a normal ferritin, he basically has poor stomach acid. And for these patients, it's very simple to treat them. We just give them a homeopathic called as muriatic acid. Muriatic acid is basically hydrochloric acid in the homeopathic form. As we dose them on this, the stomach acid increases and the chronic fatigue goes off. Another feature of a patient having poor stomach acid as a cause for low iron, they start having parosmia. They start having very, very foul smell when they are eating food. This foul smell when they are eating food is because there is inflammation in the supportive connective tissue, which is present around the olfactory nerve because the virus is persisting there. The same virus is also present within your gastric system. So when the muriatic acid or hydrochloric acid in the homeopathic form is given, basically corrects that entire inflammatory cascade, the foul smell stops happening, your smell sensations start coming back and the fatigue goes away. What else do we test for? We look at the Wbc count. If the Wbc count is very high in a patient, even that may cause fatigue because remember, if your count is high, you could be having oxidative stress. We simply have to give them Immucil and we give them another homeopathic called as Natsal, which starts to reduce the high Wbc count. However, the Wbc count could be low as well or could be normal. If it's normal, we don't do anything. But if it is low, as I said before, we use a homeopathic called as Natmor, which will slowly increase.
Doctor?
Yes?
I have a doubt.
Yeah, sure.
If we drink sodium hydroxide, the sodium hydroxide will react with the hydrochloric acid in our stomach and it will form salt. So no need to consume salt.
No, there's no connection between salt and this. I'm just talking about using the homeopathic of Natsal and homeopathic of Natmor. And I'm not actually talking about giving salt to the patient. Has this been understood? Okay.
Yeah.
All right. If the patient is having a low white blood cell count, we simply give the patient homeopathic Natmor and the patient's counts will go up, the cortisol level will go up and the patient's fatigue will get cured. Another feature that we find is something known as a cytokine storm in the patient's white blood cell count. This is something I want to explain. You have a neutrophil count in the white blood cell counts and you have a lymphocyte count. In many patients after COVID, you'll find persistently the neutrophil count is high and your lymphocyte count is low. If this is happening, you're having a cytokine storm because it's the neutrophils primarily and the macrophages which are secreting this TNF alpha, IL-1 and IL-6. Yeah? And this is what is causing you the cytokine storm that's damaging your blood vessels. So you want to decrease the neutrophil counts and you want to increase your lymphocyte counts. As the lymphocyte counts go up, your body is able to remove infections and it doesn't depend on neutrophils to do it, which is why your inflammation decreases. So for this again, Immucil works very well and it decreases the cytokine storm and the inflammation produced. What are the other things we look at? We look at CRP. This is a marker of inflammation in the body again. You will find a lot of patients who have elevated CRP post-COVID. Even post-vaccination, we have found patients with CRPs of as high as 100 to 150, where your normal is just 5. So the CRP is high, it will start coagulation in your body, it will start clotting in your body. Okay? For this, we simply use a homeopathic called arnica, and it brings the CRP down and your patient's fatigue will go away. We also check another factor called as D-dimer. If this is elevated, your patient is having clotting. Now here, the normal treatment is that you give the patient aspirin, you give the patient Clexane, which is an anticoagulant. Even with these, the patient's D-dimer doesn't go down. We've had cases with D-dimers as high as 10,000. The patient is completely stiff on the bed, he can't move. Even after a small bit of exercise, just a small step out of the bed, he starts having fatigue. Because everything is clotted and there's no blood flow. These patients can also develop pulmonary emboli, they can develop DVT, so it's a very serious situation. But it's very, very easy to fix. All you have to do is give another homeopathic called as sulfur, and you give this along with arnica for the high CRP. You won't believe within a few hours your patient will get better. They'll start moving around easily, they'll start walking easily. By the third or the fourth day, they're nearly done. The maximum I had to give arnica and sulfur was for about a week to a COVID patient. We have a doctor with us, I think she's here today, who's joining us from Indonesia, Dr. Mastika. We had a child whose D-dimer was more than 15,000. The clots had formed in the eye and the child had gone blind. After about 2 weeks of giving the child arnica and sulfur, 80% of the vision has come back in the child's eye. So the medication works so well. The child had been treated for this for the last 7 years in order to fix the problem, because the child always had a persistent D-dimer. Even after 7 years of failed treatment, when it didn't work, just the fact that we gave arnica and sulfur has brought the vision back in the child. So there's a lot of amazing things that just the sulfur and arnica does. Explaining how it does it is not within the purview of this, because it takes me almost 2 hours to explain. So let's leave that. You just have to give arnica and sulfur and your D-dimer will fall. The last bit that we check is ferritin. If the patient's ferritin is elevated, again, you just have to give the patient lactoferrin, low dose of mine, and the ferritin will go down, IL-6 will go down, and the chronic fatigue will go away. Again, remember, if ferritin is high, your patient will have iron deficiency anemia. What else do we check for? We look at the liver function test, Lfds. If your patient has an abnormal liver function where they have high alkaline phosphatase or they have high SGOT, high SGPT, this is chronic inflammation in the liver because of the virus. Here again, we give Foscoliv, which is another patented drug of ours. What it is basically just a phospholipid. It's just like a fat emulsifier. It removes fat from your liver. So we use Immucil with Foscoliv to treat and cure fatty liver cases, and it takes just around 3 to 4 months to cure a fatty liver patient just with our meds. So it basically drains all that fat out from the liver and starts healing the liver. If your LFT is high, you may have had fatty liver in the past, and this is why the COVID virus is causing you liver inflammation. So when we use Foscoliv with Immucil, it clears that out. Again, as the liver starts to become better, the patient's energy levels increase, their fatigue decreases, and they get better. The next thing we do is we check the kidney function. Again, as I said, that if the patient's creatinine is high, we just have to use Clotho, and your patient will improve, his exercise tolerance will improve, and the fatigue will go up. So this is all that we are really doing. It's very, very basic stuff. I'd like to go through it again. Also answer questions which are coming in the chat box. What is the potency? We just have to use just 200 C of all of them. Just give 4 drops 3 times a day until your patient is cured. Once the patient says that I'm feeling better and I no longer have the symptoms, repeat the blood test which I have told you that med is for. And once you find the blood test is normal, you can just go off the drug. So it's very, very easy. Michelle Stahl is saying, would it be possible to send the recording? Yes, we will send you the recording. It will also be posted on YouTube, so you can see it there. And yes, we have our videos out already on YouTube in fatigue. You can watch them. There is a small handout. If you just click on the video, there will be a handout there. The potency, as I said, is just 200 C. You just give it like 3 times a day until the patient is cured. So let's review all of this, okay? Let's look at the symptomology of the patient. So the patient comes with fatigue. What do? You run his labs first. You run the labs which I've spoken about. You do his CBC, okay? You get his iron studies done. Check if the ferritin is high or low. You check the kidney function. Make sure that the patient's creatinine is not high. Check the liver function. Make sure that the person is not having liver inflammation. If you can, also check the patient's fasting glucose. The reason why Rupali lost, or Dr. Rupali lost so much of weight and waist size basically inches after taking Immucil is because even diabetes or pre-diabetes, insulin resistance is nothing but oxidative stress. As you decrease the oxidative stress, you will literally shrink, your inches start going off, okay? Which is again why that Immucil works so well. So in patients who've had high blood sugar after COVID, just a month of Immucil has cured of the diabetes. They're off the metformin and off all the other drugs that they were on. It's so important to check these things. Okay? So this is the basic testing that you can do for a patient who has had fatigue after COVID. What are the questions that you can ask the patient? You can ask the patient, hey, do you have loss of smell? He says, yes. You have parosmia? Patient says, I have parosmia. Foul smell coming from my nose whenever I'm eating food. You simply have to give them acid mur or muriatic acid. Your patient says, hey, you know what? I'm having loss of smell, just a general loss of smell. So for loss of smell, the remedy is Natmur. And what you will usually find in these patients, you will find that in the CBC, they have a low white blood cell count. What else can you ask the patient? You can ask the patient, hey, what medicines are you on right now? If the patient is having ivermectin and you're noticing that he's using his external muscles or respiration while breathing in, please stop it. If he's taking a lot of vitamin D every day, you see in the lab that his vitamin D is quite elevated already, and you find that his creatinine is elevated, stop the vitamin D and give him Clotho. With the Clotho, the marker will drop and his fatigue will improve. Again, patients who have high creatinine will also have difficulty in eating food. They will be constantly vomiting out food. So there will be a lot of vomiting once that creat goes up beyond a certain mark. They may start having froth in their urine that starts happening. So please watch out for all these things. What else can you ask the patient? So you've asked the patient medications. You can ask the patient to stick his tongue out to you. It's very simple. Just put your tongue out. If he sticks his tongue out and you see that it's coated white, remember that is a fungal infection which you need to treat out. Okay? And treat out the fungal infection, your patient's fatigue will go. Ask him to stop zinc. So that's all you have to do. It's really easy. What's the most basic thing that you can do for your patients? Say you don't want to do anything else, okay? And you've not checked his D-dimer, you've not checked his CRP. I have not mentioned those two in the last slide, but please keep them in. Say you don't want to do anything. You simply have to just give them Immucil. And with just Immucil itself, your patient will start improving, the fatigue will start improving. However, remember, if your patient's D-dimer is very elevated and it was maybe 3-4 times its normal value, Immucil will take a long time to bring it down. If you just want to do it really fast, you simply have to give them arnica plus sulfur. So what I usually do is I just give my patients arnica plus sulfur, 200C. Okay, if I find the CRP and D-dimer is high, and then give it to them along with Immucil. And within a week or times even less than that, your patient is out of long COVID and they are back to their healthy lives. So this, I wanted to keep this really short, just about fatigue. But if you want to ask me any other questions about COVID or long COVID, I'll be happy to answer. I also want to do a small bit about Omicron because that's the current strain which is flooding the world and we've seen a lot of patients with it. And I'd like to explain a few more things about it. The dose of Immucil is very easy. It's just 1 tablet 2 times per day, and that's all that you have to do. So we have a friend of ours, Mr. Patel, who has mentioned that it's a very easy protocol in spite of non-medicals already treated 200 plus COVID patients. So he was a patient of mine who had COVID. I helped him and his family recover. And now he's basically passing it forward, and he's treated more than 200 patients just by himself. It's so easy to do. So the question is, what level of vitamin D is too high? Now, if you're taking vitamin D orally, okay, and even if your value is within the normal range, but you start finding that your creatinine is going up, that level of vitamin D is too high for you. You need to stop it, and you need to put yourself back on Clotho. If you're taking vitamin D every day and you find that your RBC count is dropping, okay, you take it, you get a test done, you see your RBC count is whatever it is, keep taking vitamin D, and you notice again in a report after a week that your RBC count has fallen, that vitamin D is too high. So there's no absolute value for it. Remember to correlate it with your creatinine and your RBC counts. Where can we find Immusul? You can contact me for it in India, or you can contact Dr. Shamal for it. Please put up our phone numbers so that people who need it can contact us. The test for fungal infection is very simple. You have to just stick your tongue out. If your tongue is coated white, that's basically a fungal infection. If you have a skin fungal infection, that's very easy to diagnose. You can just look at it and you'll know that it's a fungal infection because it'll appear like a ringworm. Okay. There is a test that you can do for the skin fungus. You do a scraping and you put it with potassium hydroxide. But if you don't have that test, you just look at the fungal and you'll know it's fungal. If it's on your tongue, it's coated white, and you will clearly know that's a fungal infection on your tongue. Treatment for hypothyroidism post vaccine. Are you asking for vaccine post V? I don't know what that means. Please specify. If it's on your nails, if you have fungal infection on your nails, then that is called as onychomycosis. We have a cytokine called as interleukin 7. We give interleukin 7 along with another one of our low dose medications, which is interleukin 9, and that drives the fungal infection out of your nails. Yeah, so we have even a doctor from Africa, Dr. Sam, who's with us, and he's been treating a whole bunch of patients using my meds over there in Africa. You can even use your normal allopathic antifungals if you'd like to, or you can even use mine. The side effect of the allopathic antifungals like itraconazole is that they're going to have impact on your liver. If your liver enzymes are already elevated, do not take the allopathics, just use mine. If your liver was normal and you could withstand a few rounds of itraconazole, then you can go and take that. Okay, so let's go to Omicron for a small bit. Now, I myself and my wife got Omicron a few weeks ago, and it was a very, very interesting thing to experience because Omicron symptoms are very different from Delta, which I also got. Omicron caused me night sweats, and these night sweats were quite bad. In fact, the sweating was so bad that the entire bed got filled with water. So for this, there's a homeopathic called as Nux vomica. You will have all seen patients who have night sweating with Omicron. Please put them on Nux vomica 200C, 4 drops 3 times a day, and you will find that these patients don't have night sweats anymore. Okay? I've had several patients of this. In fact, in a few patients, the sweating was so bad that they had drops in chloride, they had drops in their potassium, and because the potassium levels tanked, they started having tachycardia. Just by giving them Nux vomica, the sweat stopped, the electrolyte levels became normal, and they stopped having severe tachycardia. Okay. The next thing that we are finding in Omicron patients is that they have this very weird sensation in the ear. I had this feeling in the ear, and one of the doctors I think who's with us also had the same thing. So it feels like there's a small frog sitting in your ear that's croaking. You feel your ear just throbbing from inside. And this is because Omicron is infecting the ear canal, and it is causing you this throbbing sensation. We've seen many patients develop deafness after getting Omicron. They start feeling that they can't hear anything from their ear anymore. It's a severe problem and we should treat it. What we do is we have a drug which is called as emetine. It's a low dose form of emetine. Within a few doses of it, my throbbing in the ear stopped and I started being able to hear clearly. Next thing is that Omicron, unlike Delta, causes a very sharp surge in interleukin 1 levels. So IL-1 increases very, very strongly, and it's so high that even with Immusul, I'm not able to bring it down. For this, we have another cytokine, which is basically the anti-IL-1. It is an antibody to interleukin 1. So when we give my patients anti-interleukin 1, emetine, Immusul, and Nux vomica, we find these patients get cured off very fast. The night sweating stops, the throbbing sensation in the ear goes, and their fatigue and their cough, everything disappears. One of the symptoms that patients have in Omicron, again a very weird one, is they have severe stiffness of the neck joint. It almost seems as if they're having meningitis, very, very stiff neck. It's so stiff that they can't move it. Okay. For these patients, we have a homeopathic called as Brownia. This you can buy from the local homeopathic shop. This 200C again. This will treat the stiffness, the stiff neck, will also treat the dry cough of Omicron, and will save them from hospitalization due to more or less meningitis. Another thing we've seen with Omicron patients is, since there are two strains, the BA1 and the BA2, they get one strain, they take my meds, they recover from it. After a couple of weeks, they get the other strain. There is no long-term immunity from once you get Omicron. So once you recover from one strain, you are going to get the other strain sometime or the other. And usually it happens one after the other. So you get one strain, you get the symptoms go up, and then you get the other strain. One strain is causing dry cough. I don't know which one it is, but one strain is causing dry cough, very, very severe dry hacking cough. And the other strain is causing mucus-filled cough. So the patient complains of the nose stuffiness. The nose is all jammed up, it's stuffy. There's mucus-filled cough which is building up inside their lungs. For the mucus-filled cough, you need to use two other homeopathics called Heparsal and Kali Bicro. We're going to give a handout out after this. So if you use both of these together, it will treat the mucus cough. But if you have dry cough, the medications usually are simply Brownia along with my others. Emetine is an antiviral agent. It's extracted from a plant called as Ipecac. There's also a homeopathic called as Ipecac. But Ipecac per se doesn't work because it has a very small percentage of emetine. When we use emetine, there are even published papers of it online, and you can see that it's a very, very strong antiviral agent which works on things like CMV, it works in Epstein-Barr, it works even in patients with herpes zoster, so we've used it in patients with herpes. It works in patients who have continuous conjunctivitis of the eye or keratitis of the eye because of CMV and Epstein-Barr flare-ups. It works on all these things and works very, very well on this Omicron strain. So that's all that I have to say about that. Please ask me questions so I know what you've understood, what you've not understood, and let's take this forward.
There are some questions, Doc, if you could go through the chat.
Yes. So yes. No, the Immucil that you're saying, peptide, is not the one that we have. It's not yet sold online. So please contact Amanda if you're outside India, and if you're inside India, please contact Dr. Shamal. This is a question by Dr. Mirel. So please contact either one of them. Nicola is asking me, what about Omicron for naive unvaccinated? So I have not really found a difference. So I will talk about one case. She had been triple vaccinated. She got Omicron, was admitted to the hospital because she had absolutely no symptoms whatsoever, but yet was admitted. There she was given a cocktail of monoclonal antibodies, after which she got really bad. And then she was discharged from the hospital because they couldn't do anything much about it. When she came back, she saw me and I simply gave her Immucil. Within a day of Immucil, her fatigue went away. And within a few days, the nose blockage that she was having and the difficulty in breathing went away. So between the unvaccinated and the vaccinated, I don't know, because of course my sample size is very small. But there are some studies that show that there's no real difference between the vaccinated and the unvaccinated. There are some that show if you take a booster dose, you are slightly protected a little bit more against Omicron compared to people who have been unvaccinated. But the booster dose is required for Omicron. If you haven't taken the booster and you want to take it, it may protect you against severe Omicron, but it is unknown as of now. In India, we haven't really been giving the booster doses as yet, so can't really tell if there's going to be any significant impact of the two vaccines which we've already taken. One question is by Sheetal. She says, Nux Vomica treated my niece in just about 4 days or so. Yes, it is the stickiness in the eye along with the throbbing of the ears. That's true. Dr. Raji saying my 9-year-old has a headache at the back of the head today, day 6 of Omicron. That's true. They have a severe headache at the back of the neck. As I was saying, it almost feels like there is stiffness at the back of the neck at times. Does your child also have a dry cough, Dr. Raji? If so, please put them on Bryonia. If the patient has a headache at the back of the neck, again, Bryonia would be required. Please also give him my Immucil, which will really help him. Immucil is safe in even pregnant women, in small kids as well. The dose can be half for a kid, and even if there is a pregnant lady, she can take half a dose. It has absolutely no side effects in the body because it's not a toxin. It just simply helps the liver to detoxify and decrease inflammation. If there is a dry cough, please use Bryonia. That would be very helpful in patients with dry cough. Does Emmetine replace the antiviral? So Dr. Tay is referring to an antiviral combo of mine. This was my first published paper on COVID, which has low dose cytokines which are mixed together, which increase the innate and the adaptive immune system. So along with the antiviral combo and Immucil, I've also found Emmetine to be, when it's added on, works very well for Omicron. It's not a substitute, it's basically an add-on. Let's see if there are other questions. If I've missed your question, please let me know. The one question is uric acid C. If the patient is having elevations in uric acid, this could mean that they are producing a lot of hydrogen peroxide, because one of the ways you produce hydrogen peroxide in your body is by formation of uric acid. So if your uric acid level is high, one is you have an E. coli infection in the gut. Secondly, you could also be having a need for oxidative stress, or you're making too much of oxidative stress since you have a latent viral infection or you have a latent bacterial infection in your body. Ask this phone, does COVID and long COVID affect males more than females? So there are published papers that show that it does. Male patients are more affected than females. Obese patients are more affected than non-obese, because in patients who are obese and who have mild hypertension from the beginning, they have a lot of a factor called as soluble ACE2. So we know of ACE2 as a factor that COVID binds to. When you're obese or you have hypertension, there's a lot of soluble ACE2 floating around in your bloodstream. And COVID binds to it and worsens inflammation inside your blood vessels. So again, obesity is an important factor for worsening of COVID. And here again, Immucil plays a massive role because it decreases obesity. It actually decreases your abdominal fat. My patients tell me that their stomach size goes in. Like, not a single patient who's taken Immucil for COVID has ever asked me to stop it, because they love the effects on decreasing the abdomen size. How does Emmetine work is the question. So how it works is it basically works just like most of the other antiviral drugs out there, like remdesivir, where it blocks the DNA polymerase enzyme, so the virus cannot make copies of itself. That's what it does. But it has many other effects. It actually decreases the amount of iron that the virus can also take in. So it stops the virus from growing and proliferating in a whole bunch of different ways. Sonal is saying I have a brain tumor, pituitary macroadenoma. If you have a macroadenoma, please contact Dr. Shamal. I think I discussed a case with her. We've done a few cases. You could contact her and she'll be able to help you out. Rajiv, almost gone. She has been on Bryonia, first one now 30. Dry cough, that is. Okay. So if the patient is still having persistent headache, even after the dry cough is gone, please contact Dr. Shamal so she can send the Immucil pill to you, and she can also send Emmetine to you, which will help to take care of that, of the headache at the back of the neck. Dr. Abhinav is saying my wife got COVID 2 weeks back. Now she's sometimes feeling her left side is not working properly, feeling of leaning on the left, neck stiffness on the left side, what to do? Would like to have a consultation from you. Sure, doctor. There is a homeopathic called as Lachesis, which will help in this very peculiar case, because I've seen cases like this. It's spelled as Lachesis, Lachesis. It's given again as 200C, 4 drops 3 times a day or so. You can also WhatsApp me. I'm messaging you my WhatsApp number. And please give me a call after this. I'll be happy to help you out. So this is my WhatsApp number, which I'm messaging. If you need help, please do let me know. How fast Immucil reduces abdominal fat, days or weeks? So it kind of depends. Now we have a new med which we've added along with Immucil, which decreases leptin resistance. So in some patients where Immucil is not effective enough, we add leptin resistant med, which improves your ability of your body to sense leptin, and that again causes further abdominal fat loss. So while some patients improve very fast with Immucil, some are much more slower, because the problem in them is not completely associated with just NOx2 and not completely associated with just oxidative stress. So in such patients where leptin plays a role, we have to use another med to decrease the abdominal fat. But when it does, it works very, very fast. And if you combine it with the leptin med, it works very, very fast. We had a case, I think about 2 weeks ago, and he met me about 2 days ago now. And in this much time, he said that his belt buckle has gone all the way up to the last hole now, and there are no more holes left in the belt. So the waist size has shrunk so much so fast. Leptin is basically a liquid. The patient has to just take drops of it. It's a medicine which decreases the leptin resistance. It works in patients with diabetes. It works in patients who have neurological issues because of diabetes, like Alzheimer's or Parkinson's, because of it as well. So in these patients, it also works very nicely. And it decreases the total blood sugar of the patient. Any question? The dose for leptin is, we just give like 10 drops of our med twice a day, and that's all. For children under 5, you just need to give them half a pill, so you can actually break the pill and give it to them. So what is Immucil? It's a derivative of the herb kutki, where we've extracted a certain content of it to make it work. The second herb is a herb called as Tinospora, which is a common Indian herb called Wbc. It's very strongly antiviral. Again, there's a certain bunch of polyphenols that we've extracted from it. And the third is a simple nutrient called as amla, which you've seen in your markets. It just is a source of vitamin C. So again, there's a specific extract that we've done from amla, because when you extract amla out, when you do an amla extraction, it's not fresh, there's absolutely no vitamin C left in it. So there's a specific way by which it works in the body, and that little extraction that we've done helps to make it work very well. Yes, so the diabetes med that we have along with Immucil and the leptin resistance works very well for abdominal fat. It's not a homeopathic per se, so it's a low dose med. Again, Dr. Fannis, you can contact Amanda for it and she'll be able to help you out. The only contraindication of Immucil that we've seen is in patients with low cortisol. If your patient's cortisol is really very low, say your patient who had taken dexamethasone, and after taking dexamethasone for COVID, he had not tapered it off, he just stopped it. After doing this, the patient's total blood cortisol will drop. So the body goes into a state of hyperinflammation. In such patients, when you give Immucil, what you start finding is the fatigue improves very well with Immucil, but your patient will start having nose watering, because the body goes into a mild state of hyperinflammation. So you just have to decrease the dose of Immucil, and you need to put them on some supporting medications for the cortisol. For example, pulsatile and Natmor will help to bring the cortisol level up, and then the hyperinflammation will go down. That is the only side effect of Immucil that we've seen to date. Is there any other questions over here? So we have many doctors here in our group who have treated so many patients with COVID, and they've been using this method for both patients with COVID as well as long COVID. If any of the doctors in the group want to share a case, an interesting case, you can just unmute yourself and talk about it. It can also be used as a preventive med. That's a good question. Yeah, it can. There's a question by Dr. Asif. Is it also preventive med? So you can also take Immucil as a preventive medicine. In fact, I've been taking it now. It helps to keep my abdominal fat in check, and I take it so that I don't become insulin resistant in the future. Because all of us undergo some form of oxidative stress in our lives. All the food that we eat, everything that we do drives oxidative stress. We are faced with so many infections constantly. Oxidative stress is always elevated. Again, for this, we are trying to develop the 8-isoprostane test for the mass public all over India, so that you can, in the comfort of your home, you can check your oxidative stress markers and you can take something to decrease oxidative stress. Oxidative stress is the primary driver of most of the diseases that you're going to face in your life, whether it's diabetes, hypertension, no matter what it is. By the age of 60, almost all of us will have one chronic disease that is affecting us. By the time we are 65, it's going to be 2. By the time we are 70, it's 3. And by the time we cross 70, it's more than 3 chronic diseases. Most of them are driven by oxidative stress. So again, back to the question is you can take it as a preventive medicine as well. Is there any doctor you would like to talk about their cases? If there is, please say yes and we can let you talk. So no one's there as yet today. Okay, so let's...
Actually, I'll just share. Last year I had got COVID and I was on Immucil, and I didn't know why, but I didn't know the effects of Immucil at that time. I was not studying with Dr. Tariq. So after a few weeks, I was able to squat. I had a really big abdomen, and though I'm thin overall, and that was because of the post-delivery, the size had not shrunk. So post-COVID, I used to feel, oh, it's because of COVID. Thank God I got COVID. So my abdomen has shrunk. But later, once I started studying with Dr. Tariq, I realized that it is because of Immucil that my abdomen has become smaller. So it really works quite fast. And I recovered from COVID without any allopathy medicine, not even crocin. I had not taken even paracetamol, nothing at all.
I think you had the Delta strain at that time, no? You and your husband.
Last year.
Right. That was a deadly strain. And I think we have Dr. Avni also with us, who I treated with COVID right about a few weeks ago.
2 weeks back, I had high fever and I suffered from Omicron. But luckily, I was having all Dr. Tariq's meds, including anti-IL-1 and all. In the evening at 7 o'clock, I got high fever and severe chills in my body. And I called Dr. Tariq. By 9 o'clock in the evening, I started all the medicines. By 2 o'clock in the night, all my fever and all my symptoms were gone. I had severe sweating. It was like my whole clothes, all my bed and all had become wet. And by morning, I started all fine. I was feeling better, all fine. Still, I'm having some like fatigue and all. I'm taking treatment from Dr. Tariq. But it was amazing. Like within 5 hours, all my symptoms are gone and I'm feeling better. I was actually in a bad shape. I was shivering so much when I had my fever that I have taken 5-6 blankets and comforters and nothing was helping me. But his medicine did wonder on me. It's like hats off to you, Dr. Tariq. Really amazing.
Thanks, Avni. I have known her since I think now 22 years.
22 years.
22 years.
Yeah. Actually, I'm a liver failure patient and he has helped me to recover through it. And amazing. Like nobody had done so many treatments. I had shown it to so many doctors. Nobody could diagnose, but he helped me to diagnose the cause. And I got cured through his treatment.
Thanks a lot, Dr. Avni. I'm sure there are many doctors here, including Dr. Chen is here, but her microphone isn't working. She is the one who discovered that these patients with dementia are having fungal infections that are going to their brain. And she told me this over the phone. So that was damn cool. Okay, guys. So I think, are there any more questions? Asa's phone, is it also preventive med or also post-COVID? Is this being marketed in the USA yet? So no, it's not being marketed yet in the USA. We are looking for distributors in the USA who could distribute it. So if you know anybody who is interested in being a distributor of it, please do let me know. Amanda is asking COVID combo, Emetine, Naxomica, and Mucil anti-alcohol. Okay. This is Dr. Sunita Anand who's saying, superb, Dr. Okay, so thanks a lot for joining me. If you still have any questions, you can just ping me on my WhatsApp and I'll try to help you out. Yeah. Thank you again, everybody, for joining. And I hope you can spread this message out and help as many people as possible. We are going to post this on our YouTube channel as well. And once it's out, we will share the link with all of you. Please help all your friends out, all the people you know who have COVID. And please understand this, that post-COVID, 40% of people have chronic symptoms. In the study done in AIMS, almost everybody who they've seen with COVID, who had mild hypertension, started to have severe arterial stiffness after COVID. which did not clearly reflect onto the values of hypertension. So while these patients still had moderate or low blood pressure, or moderate to well-controlled blood pressure, the arterial stiffness increased very, very, very dramatically, which is why we see a lot of patients with COVID getting heart attacks. If you think that aspirin is going to protect you against that, don't be fooled by this. Again, there are enough of publications coming out showing aspirin has absolutely no effect to protect you against the long-term sequelae of COVID, does not protect you against stroke or heart attacks. Okay? So please share this message with as many people as you can so that we can spread this word out. Thank you again, everybody, for joining me for this interesting program. Thank you.
Thank you, Dr. Tariq. So the CID of the body has just ended his investigation. I hope it helps as many people as it can. Like we said, we would like to, touch every individual that is possible, because COVID is here to stay. It's not going to go. So we need to be able to cope up with this. Hopefully life will get back to normal very soon with Dr. Tariq's molecules and his knowledge and information. So you can connect with Amanda, me, or Dr. Tariq, and we will take you forward. And I am suffering with Omicron from past 3 days. So this is the Immucil if you want to just have a look. Is it visible?
Yeah, it's visible.
Yeah. Okay, so this is just the bottle. Yeah.
Thanks.
Okay. Thank you, everyone. We really appreciate you giving us so much time. Thank you. Thank you for
Thanks, everybody.
Thank you.
Bye.